My name is Mohsin Rashid. I am a pediatric gastroenterologist and professor of pediatrics at Dalhousie University in Halifax, Nova Scotia. I also volunteer for the Canadian Celiac Association. We will be addressing an important question today, and that is, once you are diagnosed with celiac disease, should your family members be screened as well? Before we do this, a brief introduction to celiac disease might be helpful. For some of you with good knowledge of celiac disease, this introduction may seem very basic, but for others with limited knowledge, this information is essential. Celiac disease is a condition in which the ingestion of gluten, which is a protein present in grains including wheat, rye, and barley, causes inflammation and damage to the lining of the small intestine by an autoimmune mechanism in genetically susceptible individuals. This can lead to a variety of symptoms and the inability to absorb nutrients from the diet. Celiac disease is a very common disorder, affecting about 1 in 100 people. It can present with a variety of symptoms, both off the bowel and outside the bowel. Some of the bowel symptoms include chronic abdominal pain, diarrhea, vomiting, gas, and bloating. Symptoms outside the bowel include skin rash, mouth sores, anemia, joint pain, fatigue, weight loss, and many more. A person may have one or more symptoms or no symptoms at all. There are highly effective blood tests available to screen for celiac disease. The one used most commonly is IgA, tissue transglutaminase antibody, in short called TTG test. The diagnosis of celiac disease is confirmed with a biopsy, which is a small sample taken from the intestine by endoscopy to demonstrate inflammation. The treatment of celiac disease is a strict gluten-free diet. After starting the gluten-free diet, the symptoms resolve, inflammation in the intestine goes away, and the celiac blood tests become negative. The timing for this varies between individuals, but if gluten-free diet is followed properly, this will happen. Celiac disease commonly runs in families. About 10 to 15% of first-degree relatives of a person with celiac disease may have celiac disease. This is quite significant. Therefore, it is recommended that all first-degree relatives, including siblings, parents, and children, should be screened for celiac disease. So if you have been diagnosed with celiac disease, advise your immediate relatives to see their family doctor and get screened with the TTG blood test. This should be done even if they do not have any obvious symptoms. Many people with celiac disease have minimal symptoms and may not feel very ill. However, after the diagnosis and starting a gluten-free diet, they feel great and their quality of life is much improved. Some experts also recommend screening all second-degree relatives, which would include grandparents, uncles, and aunts. Certainly, if any one of them has any symptoms or another autoimmune disorder such as thyroid disease, screening would be very beneficial. In my own practice, when a child is diagnosed with celiac disease, I recommend screening and quite commonly find a sibling or parent with a positive test. I have found that dads are often a bit hesitant to get screened. However, if they get diagnosed with celiac disease and start a gluten-free diet, they feel great, as many of them actually had symptoms for years. It is said that whether you develop a disease or not depends on how carefully you chose your parents. Celiac disease is a good example of this. Please sign up at the link below so that a resource can be sent to you that can be shared with your family doctor. Also, keep visiting the website of the Canadian Celiac Association for up-to-date information on celiac disease. Thank you.